Good evening, ladies and gentlemen. Welcome to another episode of Arab TV with you, Zaid Faransso, and our guest today, Ahmed Saleh. Ahmed is a chiropractic student. He's a candidate for a doctor in chiropractics, and he's with us to tell us about this interesting field. Welcome, Ahmed.
Thank you for having me, Zaid.
So I started by introducing you with a study with this field that we were interested in, and tell us a little bit about what drove you to that direction.
Well, it was actually a little bit of a story. So I was actually working in a different field for several years, and I was a motorcycle enthusiast. And as you can see from the slide, if you want to put that up, so you can see,
Let's see that. Yeah.
Mm-hmm. So I loved motorcycles, and I was driving one day from from work to home actually, and some person didn't see me. They were in the left lane, they were churning, and they hit me on my motorcycle. Eventually, this severely injured me. Nothing was broke, but I went to the emergency room and then went to just a series of medical doctors, from the general practitioner to an orthopedic surgeon to a neurologist to so on and so on to physical therapy. And what occurred was, I seen results, and there was just a point where I was diagnosed with chronic pain, and I just could not progress further from that. So there was something that was just holding me up, and I couldn't figure out what it was. So I went to a chiropractor. Never been to one, didn't know what they were. And again, I was working in an entirely different field. I didn't know anything about the biology or anatomy. I was, in shape. I worked out. I was training actually for a marathon, which happened. It was supposed to occur about a month after the accident occurred, and I couldn't even run anymore. Although what they thought it was a shoulder injury. So I went to a chiropractor, started seeing a chiropractor. There was sessions that he prescribed that I would attend, and seen him for about, it was 3 months, and then it slowed down till it was in the 6-month mark. And I went from about 8 out of 10, which is pretty severe pain, when it got the worst.
That's the 8 out of 10 in the level of pain, you mean?
8 out of 10 on the level of pain.
Yes.
So it was very severe pain. Mm-hmm. And that's when it was at its worst. And it was always no less than 5 or 6 out of 10 on a regular basis. So it was chronic pain. I was actually prescribed epidural steroid injections to help with the pain. Right. And I did that for once, and then I read about the side effects of long-term of taking these kind of things. I was always just about eating right, exercising, just living a very healthy lifestyle.
So for an explanation, just to mention this briefly, mm-hmm. This level of pain is measured, is usually a subjective way to tell patients on a level of 0 to 10 or 1 to 10.
Correct.
If 0 is no pain, 1 is a very minimal pain, and 10 is the most intense pain you've ever felt in your life. Mm-hmm. What would you scale it? And you mentioned 8 out of 10, which is really significant.
Yes.
Okay.
So I was 8 out of 10 when it was at its worst,
yes.
Be it if I, exercise or try to exercise or move the shoulder, or just after a long day, a stressful day at work. Mm-hmm. And then I was at my best, usually more or less. That was the worst. Usually it was around in the 5 or 6 area out of 10, which is still pretty bad,
yes.
And this was on a regular basis. So again, I went to a chiropractor, and it was for around like 3 months. It was pretty, head on, and then for the other 3 months, so it was a total of 6 months, and my pain just went away entirely. Not just my pain, but my function. I was able to use my shoulder again. I was unable to lift my arm up just to turn on a light switch at a point, and it was just pretty severe.
And with the therapy, everything kind of tended to go back to normal.
Yeah, so everything tended to go back to normal. I was able to function again. I was able to get my life back, able to exercise. And that was very important to me, and it should be practically anybody, just having the full function of their body, especially if they had it before.
Sure. Let me ask you this question. When you were under medical care,
yes,
were you informed what was the diagnosis? Mm-hmm. What was the final evaluation result?
Yeah, so like I said, there was nothing broken, no fractures or breaks in any bone. So we went and we tried to, there was MRIs were done, X-rays were done. So these things were unable to find. So it was from the orthopedic surgeon perspective, he felt it was muscle weakness only, which it really was. And but there was a little more to it, and that's what chiropractic did. It helped me just take it to the next level. It addressed the muscle, but it also addressed the nerves and the impingements, which is what was going on with me.
So that was the start. This is what got you
That's
interested in the whole
what
field.
yeah, that's what made me find what chiropractic was and got me interested in the field. There was years later I continued working in the field that I was before, and I started thinking about it, and I wanted to do something that I can just help people, get better. I felt like I fell kind of through the cracks a little bit with how things happened with me, and it was something that kind of opened my eyes, and I just wanted to do
But
something.
that was something I wanted to ask about also. It's one thing to be convinced of a theory or some belief. It's another thing to change your whole direction to go and follow that. So when was the moment you felt you're really rooting towards that field?
When I was able to get out of bed without having to just drag myself, or it was kind of a moment when I realized, like, when I was running again, 3 miles a night, and when I was, doing things that I was unable to do before, that kind of it kind of took away everything that I loved, and then I got it back, and it was kind of like disbelief, like, oh, I can still do this, and that was kind of why I was like, okay, I really want to do this, and I just felt chiropractic was, and I love working with my hands, and chiropractic's pretty hands-on, so that's another reason, like, why I chose the field.
And you probably
One
run
of
your
many
research and
Yes.
looked around and asked people and checked places. And
Yeah, I did a good amount of shadowing. I, contacted a lot of chiropractic doctors. I spoke to even physical therapists, medical doctors, friends of mine, even, from all different healthcare fields. And it was, it just kind of the light kept shining back toward chiropractic.
And you eventually decided to make that a reality.
Yeah, so I'm originally from Chicago, Illinois. I'm a Bulls fan.
Right.
Grew up with Michael Jordan, so I'm a big sports enthusiastic. And so I moved actually from Chicago all the way to California just for my education. And I started in the East Bay, my education. I have about 1.5 years to complete it.
Awesome. So you're probably the best person to ask because you've run the whole search and the whole analysis phase before you get into that field. You did it definitely because you had a job. It's not like an 18-year-old trying to decide what to do in life. What made you decide about that, and what makes chiropractics an appealing science?
Well, we could look at the second slide. I'll give you a little bit about
Let's take a look at this second slide.
You can see chiropractic education. Actually, it was a very big decision. It wasn't just like, I'm just going to do chiropractic. I was in a different field. So you can see from your slide that, there was, it's a pretty equivalent to medical or pharmaceutical or dental education with the elective. So I actually had to go back to school and get science. I had to learn the physics, the chemistries, the anatomies. And then from there, I had to, apply and get accepted and take all the pre-qualifying exams. Just a little bit about chiropractic education, so we have to take all the pre-electives which you've had to take, to enter medical school. And you can see from the next slide a little comparison of medical education and chiropractic education. We actually do a lot of much of the same coursework, if you can see, and we just hit heavy on certain things that we do a little more. It's not that we do them better, we just do them more. For example, like certain orthopedic exams, a general practitioner wouldn't have to do on an everyday basis. So they do cover it, but we cover it more. X-rays is another example. Of course, we're going to be addressing your nervous system and your spine and extremities. We want to know what's inside of you. We don't guess when it comes to that. It's a science and as well as an art. It's very specific and scientific, so everything is measured and calibrated very quantitatively. So you can see from that slide that we're very comparable in many aspects.
I see it's a nice hands-on skill as well when current medicine have shifted into using a lot of radiology tests and lab work to figure out what's inside. Chiropractics and alternative medicine lines have emphasized all the way on using your hands and your skills and kept building that skill. Isn't that right?
Yeah, well actually chiropractic, the word itself means done by hand. And we are hands-on. So we do things hands-on, and we're a field that's natural. We don't prescribe, nor do we. It's not something that we want to do. There's already a field that does that. The medical doctors like yourself. So we would co-manage a patient together, and if prescriptions were necessary, that would be the side of the patient that you would manage, and we would manage the more natural side, and be it with the skeletal, the musculoskeletal system, the nervous system, just to name a few. And that's what we would do just by hands.
Muscles, nerves, and that's all. What are the majority of the problems that you usually handle?
We're known for, but we're not limited to only doing this. We're really known for neck pain, back pain, headaches, and we're known for that because even certain publications that's come out recently is shown that we can actually there's been some research that's come out to prove that chiropractic is actually equal and greater than efficacy than certain ibuprofen, certain opiates, certain types of painkillers. But because what we do is we don't address the symptom, as you know.
Exactly.
What that will do is just cover up the pain, and if it's just putting a Band-Aid on something that's gonna come back. So what we do is we'll address the underlying cause of the problem. So not just the smoke coming from the fire. We try to find the fire.
Yes.
And we address that, and that will stop the pain, which will restore the function of the person.
Nice. Sounds nice. So we can say that some of the main cases that you get are cases of pain, problems that happen after injuries,
Yes.
post-surgical pain,
Yes.
complications of.
So what we address, one of the main things that we address is called a subluxation.
Okay.
A subluxation is when the spine, a vertebra in the spine, if you could see, this is an example of a model spine. I actually have another one right here, which might be a little easier for us to view. So if any of these vertebra right in here shifted out of place, it can put pressure on the nerves that are coming down through the spinal cord from the brain connected to the brain. So a subluxation is something that we address, again, by hand. So subluxation occurs in three ways: thoughts, traumas, and toxins. Like you mentioned, be it a motor vehicle accident, a car accident.
Yes.
If that's a trauma, or if someone fell or it was in a sport injury, we also deal with a lot of athletes. So if there was a trauma put into place, what would happen is we would deal with that. That's one way subluxation can occur. And again, everybody's familiar with traumas, the macro trauma, which is a car accident, falling. But there's also micro traumas, which occur on every day, just wear and tear on your body. If you're sitting in a bad posture position, which we'll talk about in a little bit, I have a slide for that. Another thing is thoughts, stress. Stress really does affect the body. You could probably talk a little bit about that.
In the sense, do you mean in the sense of putting more pressure on muscles, or?
Just the whole body overall.
Oh, yeah, but stress as a cause of inflammatory reaction that can trigger things that most people don't think of as major, but they can accumulate over a long period of time.
Yes.
We can probably see the most evident effects of that thing on weight changes, organic diseases that can develop after stress, probably less commonly as bone wear and tear or muscle problems.
Yes. So like I said, thoughts were one, and then the last one, which is toxins, is what we eat.
Yes.
So what we eat, everybody knows if you eat bad food, it's bad for you. So that can also cause subluxations in the body. And if someone's eating bad food day in and day out, it's going to affect their nervous system. It's going to affect many systems in their body, circulatory system, their blood work, just many things. And that's another way subluxations are caused.
So in short, this delicate connection of one vertebra with another that is governed by their shape, their location, a whole lot of muscles and discs and structures in that area. When one tiny bit of that structure gets out of place, that's when we start to have the problem. And it could be mild, easy in the beginning, but then it accumulates.
Yeah, that's correct. Actually, for example, right here in the first one, which is known as your neck is known as the cervical spine, as you know, for the viewers. So the first one is called cervical 1, C1. And if you look right over here on this table, you will see that what happens is actually that's where the nervous system, your spinal cord, first exits into the spinal column. And what it'll do is this area right here, if there's any shift in it, that'll affect, think of it like a traffic jam.
Yes.
If there's, a certain amount of cars blocking, how much information or how many cars would you get past it? So if you have, for example, a problem in your neck, some people who never think about a problem in the neck can cause problems, below that segment.
Yeah.
So that's an example of what you were saying.
Not just that, but some people would think that a problem in the neck would necessarily mean being in a car accident or falling or being hit by a ball or something.
Yeah.
Where in fact, a problem in the neck can be as easy as staring at your computer screen in an uncomfortable position, right?
That's entirely true, actually. And a lot of people, especially in the Silicon Valley area, they would have a desk job.
Yes.
And I actually have an x-ray of someone sitting in a desk, and it can show you how they're in bad posture. They're hunched over with their arms out for their keyboard and their mouse, as well as their neck extended, flexed in the lower neck. And I'll show you right here on this model. It's flexed forward in the lower neck and then extended, which is brought back in upper neck. So that way they can look at the screen like so. And if they're doing this for 8 hours a day, what it'll do is it'll cause neuroplasticity, which is training the neural pathway. It's kind of just like drilling something in your head over and over. You're learning. It's gonna cause the body to have memory, like some people call it muscle memory as an example. The ligaments also have a memory. So what would happen is these ligaments that are holding all these columns together, be it from the discs to all the ligaments that are behind and all the different sides, what'll happen is they'll be either stretched out or tightened in certain areas, and they'll hold that posture. For example, I used to work in an office job, and I would go and run and go to the gym almost 5 days a week minimum. But if I held that position every day, sometimes I might think, oh, well, I have a problem in my neck. And it's because I was running and I fell or something of that sort. But it could be because I was 8 hours for 5 days a week for months and months, if not years, holding this posture. So what occurs, your body will retain this posture even after you stand up.
Yeah.
So one thing chiropractors do, we'll observe your posture. It's actually a window into your nervous system. So what we do is by seeing what way you might be rotated, be it you're not in a straight symmetrical line.
Wow. I'm self-conscious now.
So we'll recognize that by standing up. We'll see how your proprioception is. So what happens is people train these muscles and ligaments to either tighten, strengthen in certain ways, and they'll hold that posture even if you go and work out.
Why do you think those muscles and ligaments tend to sit in the wrong position? Why doesn't our body tend to fall in its normal shape?
Well, the body's not made to be sitting in a seat in a desk all day. We're as you know, we're made to move. So people are not moving. Even the people that do exercise, they might move certain amounts of muscles, maybe not all of them. I hope they do, and many do, but some might not know the right exercise to move it back. For example, if their neck is jutted forward, what muscles they have to strengthen to pull it back.
Yeah.
And that's actually one of the things that we do as chiropractors is we prescribe very specific and targeted exercises for rehabilitation of these delicate structures so we can pull them back in the correct position. So that's one of the things that we can do, and we can do that through rehabilitative exercises. As chiropractors, we can actually show these rehabilitative exercises, and if necessary, if it's a severe trauma, where we can actually give a prescription to see a physical therapist, just like medical doctors, like you can.
Okay, so we mentioned a few of the ways that we can use to treat conditions like this. Let's assume that we have a patient who is complaining of subluxation, and let's say that it's a mild case. What are the options that those patients have?
Well, the first thing this patient has to do is see a chiropractor. And from there, they would have a thorough exam, and they would, address their diet, their lifestyle, any traumas they had from accidents to falls. Some chiropractors even have a stress test they can give their patients to see what it is, because no matter how much you can address things, if stresses are there, they might be, like a stress on a bridge. If it's always there, the bridge will eventually collapse. So what they can do is first visit a chiropractor. Just like you see your dentist twice a year, people should go visit their chiropractor. I mean, we brush our teeth because we don't want cavities, but what do we do about, maintaining the curvature as well as maintaining the structure of the spine?
But what's the look of like the general health industry to that? Would, for example, someone's insurance support a visit to the chiropractor twice a year?
Most insurance, I would say majority of insurances do cover, actually more than twice a year, There's, multiple visits. It depends. It's by insurance, and it's every insurance company is a little different. But Medicare does pay for chiropractic, as an example. And most major, especially when I used to work, I had a major insurance company, and they covered many and multiple chiropractic visits a year. So visit your chiropractor, see what's going on. They might, if clinically justified, they will take an X-ray. And the X-ray is just like when you go to the dentist, they want to see there's no pathologies. To rule out pathologies as first as you would do as a medical doctor.
Nothing serious, nothing needs surgery right now.
Correct. Nothing that needs emergency care, that we would have to elevate your care, because we're trying to get you better. No matter, we'd like to refer you to the right person. If it's not us, we have a scope of practice.
And you probably need time to get things done from your side. So if it's something that cannot wait for a day or two, let's say that it's a atlantoaxial subluxation. This is not a room for a chiropractor to practice. This is where you need a surgical intervention.
Well, it depends how big of a subluxation it is, and I actually have an X-ray of one that we could take a look at in a little bit, of an atlantoaxial subluxation. And that is something, but if it's from a severe trauma, and I'm pretty sure that's what you're referring to, because in the medical realm, when they say subluxation in that area specifically, it's pretty severe.
As we're talking about a condition in which life and death can be determined by movements.
Yes, if anything is emergency, we're going to send you to the right person. That our prerogative is to make sure you get better as a patient.
Assessment is one.
Assessment will be one. The other thing is people should start by watching some of their postures, their daily, the daily things to do. For example, texting. If people have their neck down, so they'd have their neck down like this for hours and hours. And what's going to happen is you're going to you're going to apply compression on the disc. And actually the most significant area, the area that has the most amount of disc herniations is in the back of the disc, to the side a little bit. It's called the posterior lateral, as you know. So what would happen is that's the area that can easily get a disc herniation. And by doing this, you're actually creating a better chance of that occurring. So maybe lifting the phone a little higher up and just keeping your neck straight like so. So that's an example of something they can do. When they go to work, check their desk for ergonomics. Make sure everything's right in front of them. Their monitor is at eye level, and they're sitting up straight, and their feet are straight on the ground. So it would be about a 90 degree, 90 degree, and 90 degree. So it would be 90 degrees at the knee, 90 degrees from the hip, and then it would be straightforward, and then their eye would be at eye level with the monitor. That's another thing that I think we see a lot of patients
assess,
with.
adjust, and maybe even observe.
Yes. Some people, we've told some patients, for example, if you're not sure how you're at work, have a coworker take a picture of you, and we can bring it in, we can talk about that. Some other things that they can do is, if they do see a chiropractor, the chiropractor will, address certain things that they can do, such as exercises, certain things that they can do at home, exercises to restore the curvature of the spine and the posture.
All right. So this is a cry out for people. It might be easier than they think, right?
Yeah, actually, there's been reports that are out there that show even the most highly selected individuals for surgery have shown a significant amount, I forget the percentage off the top of my head, that they improved a lot more with conservative care, such as chiropractic being one of them, rather than surgeries. And that's because, as we've kind of went away from doing surgery as the first option. Now we're kind of coming like, okay, let's do that if nothing else works. Because conservative care works a lot better. Chiropractic is very conservative. It doesn't really have any side effects. It's all hands-on. It's drug-free. It's natural. So that's just a few things about it.
What other problems the patient might come up with, or what are the other complaints you frequently see, or you suggest that people refer to a chiropractic to take care of?
Well, chiropractors, again, we address the nervous system. The nervous system is kind of like the IT department. It connects to all the different systems, circulatory, or all the different organs that are vital to your body. So these nerves will exit from different areas to all the organs, as you know. So what we can do is we've seen patients that chiropractic actually help things that you would think as maybe an average person, you would not think that it can help, and that's because it relieved pressure on the nerves that are going to organs.
Right.
Some things besides pain, it can be just overall health. I believe is again, just like a dentist, you want to go and get that checkup and just make sure you're getting everything taken care of. You don't have any degeneration going on, because you don't know that. You can't see inside of yourself, and that's one way that we use x-rays to determine that.
Nice. Where do you see the future of the field?
The future of the field? Future of the field is kind of, I like to compare it to the dental field as an example. You take your children right away when they're kids to the dentist to make sure they have no cavities, get their cleaning. Then they grow a little older and you take them for braces. And then as you grow older, you keep maintenance. So what's cheaper, for example, to a person, for their car to break down or for them to change the oil on a regular basis? And it's a preventative thing. I see the future as chiropractic being more preventative rather than reactive to people's injuries and traumas and pain. Right. So I see it. People coming in, as you know, birth could be a traumatic event for a baby. They went from being inside of a human to being into this harsh world within hours or seconds once they exit into it. So I see it as within while the child is an infant, they would go to a chiropractor to get checked, because sometimes when they're pulling them out, they can cause a subluxation in the neck. So we check for that, and we won't x-ray the baby because we recognize you wouldn't do that. That's medically something that's not done.
So it's like it's going forward because of the increased emphasis on prevention rather than treatment, which has been the trend even in general.
Preventative treatment, yes.
Preventative treatment as well.
Yes.
Well, it's quite an interesting idea. We all know of the field, and we probably don't realize the size of this practice, how much it interferes with our daily activities.
Yeah.
Thank you for the enlightening talk. Thank you for the cases you brought and for the demonstrations. I think after these few minutes, people will be more aware, at least of the few things that you mentioned, their posture, their day-to-day activities, and they will probably think of chiropractics as an option rather than something they've just heard of but know nothing about.
Definitely.
Thank you, Ahmed. Thank you for the information.
Thank you for having me, Zaid. Thank you.
Thank you, ladies and gentlemen, and we'll see you again next week.